My name is Jaleesa Conklin. I am a senior psychology major from Atlanta, Georgia, attending Hampton University in Hampton, Virginia. For the course, Theories of Psychotherapy and Counseling, I will provide you with a video of a mock therapy session. The first 5 minutes will be a brief overview of the type of therapy we will be discussing, which is psychoanalytic therapy. The next 10 minutes will be video from an actual mock therapy session. In this video, we will cover transference as well as dream analysis in the process of uncovering the unconscious and childhood traumas. Thank you. Psychoanalytic therapy. Psychoanalytic therapy is based on Sigmund Freud's theory of psychoanalysis. Sigmund Freud was an Austrian neurologist who was popular for his stages of psychosexual development, which theorized how the personality was developed over the course of the lifespan. He is also popular for his structure of the personality, which included the id, the ego, and the superego. Important aspects of this theory include free association, dream analysis, as well as transference analysis. Let's start with free association. Free association is when the client says whatever comes to mind when the therapist says a word. The therapist then looks for and interprets patterns that are in the client's responses. Dream analysis. Dream analysis uncovers repressed feelings that may be hidden in the symbols that appear in the client's dreams. The therapist's job is then to help the client discover the meaning and significance of those symbols. And lastly, transference analysis. Transference analysis explores the transfer of the client's feelings and emotions from one person to another. For instance, the client's repressed childhood feelings towards a parent may be transferred to a partner in an adult relationship later in life, or to the therapist during the session of the psychoanalytic process. Key information related to the theory includes the release of repressed thoughts, experiences, and emotions. Also, the therapist-patient relationship is key. It is central to the healing process, as the original theories of attachment, which focused on the quality of bonding between infant and parent. Moving on to transference. This is the transfer of earlier emotions and needs to people and events in the present time. Resistance is the stage of therapy when the client becomes overwhelmed by the release of painful and repressed feelings and tries to avoid dealing with them. However, eventually, as patients become more comfortable and less resistant to facing their issues, they are able to understand their own motives and their own behaviors. At this point, the healing can begin. This theory is used with multiple populations. The most common populations are clients suffering from depression, dealing with emotional struggles, as well as emotional trauma. Clients who exhibit neurotic behavior patterns or self-destructive behavior patterns may also benefit from this type of therapy. Those who have personality disorders as well as ongoing relationship issues may see some benefits from the psychoanalytic therapy. Psychoanalytic therapy focuses on the unconscious processes as they are manifested in a person's present behavior. In the psychoanalytic therapy, the therapeutic relationship, the therapist's self-disclosure of counter-transferential material, and how the disclosure might benefit or harm the therapeutic process are central to this theory. The clinician will choose to share, and she will also choose to hold back. In psychoanalytic therapy, the work of the session is helping the person work through childhood issues and feelings that might have been adaptive at the time. However, at this point in time, they are not currently working and are not truly applicable to the current situation. The clinician will gently suggest an interpretation. And if the client is open to it, this will allow for a dialogue that provides insight onto how past relationships are affecting current relationships.
I'm here because I have a lot of sex.
Okay. And what's the problem with having a lot of sex?
I don't feel satisfied after. I feel empty, lonely still.
Empty and lonely.
Yes.
Well, is there anything else happening that brought you in today?
Well, I had a terrible dream last night.
Terrible dream.
Yes.
Tell me about it.
Well, I was having sex with a professor in his office, and my cousin walked in on us and he yelled disgusting. Then I woke up
And how did you feel after you woke up?
just broken.
Broken. I'm sorry to hear that. Well, tell me about your childhood. What are your parents like?
Well, my mom, she was very unorganized, overweight, drank a lot, she smoked a lot. She was just very inconsistent.
You said smoked a lot. Um, can you be more specific?
She smoked a lot of cigarettes.
Mm. Okay. And what else about her?
Every time I tried to go to her, she was never able to help me with anything or she just wasn't around.
So what did you do then?
I went to my father.
Okay. And tell me about your father.
My dad was a professor, very consistent man, very honest man. Looked up to him, admired him a lot.
Did you? And what did he do for a living?
He's a professor.
And what did your mother do for a living?
Nothing,
She was a stay-at-home mom.
if you could say that.
Okay. You said your father was a professor.
Yes.
It's to my attention that the man in your dream was also a professor. Did you notice that?
I didn't think about it like that.
Okay. Well, tell me about your sexual life today.
Well, usually I go to a bar. Maybe not 5 minutes into it, I go to the bathroom and have sex with someone. And then I go back out to the bar, converse with other men again, and go back to someone's bedroom or my house and have sex with somebody else.
Mm. And how often do you have nights like that?
Mm, Almost every other day.
Okay. How do you feel after these nights? The morning after.
Mm, I don't feel anything. I feel empty, lonely.
Can you describe any events that lead up to this? How do you feel leading up to these nights? What are you thinking about before you go out to have these nights?
Feel angry and frustrated. Sort of like how I felt when I deal with my mother.
Okay. And you said you used to turn to your father?
Yes.
At what age did you start turning to your father?
Mm, about 13.
Okay. And what age did you become sexually active?
16.
What happened when you found that you couldn't turn to your father anymore? When did you stop turning to your father?
Mm, I guess at 16 when I started having sex with men.
And what are you looking for in these men?
Hmm. Just someone who will listen and know me.
Kind of like your father. That's interesting. What else has been going on?
Well, I had another terrible dream. That's why I came in today.
Okay. Well, tell me about it.
Well, I was being teased. I was a child and I was fat, and all the kids were teasing me at lunch, and they were throwing food at me.
That does sound upsetting. And so, you said you were overweight and they were teasing you because you were overweight?
Yes.
Okay. Were you overweight as a child? Did you experience any
I was
issues?
very overweight. My mother would just feed us sweets, candy, fast food, never anything nutritional.
And did your mother notice you were getting overweight?
Yeah, but I don't think she cared.
So you still going to the bar?
Yes.
Has anything changed about how you feel after your nights when you go to the bar?
No. Still feel empty and lonely.
So tell me more about that. What goes through your mind when you're getting dressed to go out at night?
That I'm gonna meet a new person, and hopefully, when they touch me, they'll know me.
Are you looking to? You ever look to start relationships with any of these men?
No.
So tell me this: is there anybody that you've been seeing for a while now, or having sex with for a while now?
Yeah, actually, Bobby
Okay, Bobby. How did you meet Bobby?
at a bar.
So what was different about Bobby? Why are you still with him now, or having sex with him?
Usually when I have sex with these men, it's not really much after, but he wanted to talk, get to know me. He checks on me, he calls me, he texts me even after our intimate encounters.
How often do you see Bobby?
I say like once a week.
Is it anything different when you guys meet up?
We stay longer periods of time.
And so, if you're with Bobby, why are you still having sex with other people?
I don't know. I just still don't fully feel like he knows me yet.
Okay. So tell me about Bobby.
Bobby, he tries to get to know me, and he's consistent. He, always calls me, checks on me.
But still, that's not enough.
I guess not.
I heard you say that he tries to gets to know you. How does he try to get to know you?
Usually with other people, after we have sex, that's it. We don't really talk about anything. But with him, we sit and cuddle for hours, and he asks me questions about me and tries to really get to know me.
And so, if Bobby's in your life, why are you still having nights at the bar?
I'm not sure. Maybe I still feel like he doesn't completely know me yet.
Do you think that you know what that is or what that feels like to be completely known?
I believe my father completely knows me.
So, where's your father now?
Unfortunately, he passed away.
Oh, and how long ago did he pass away?
About 3 years ago.
Is there anything else that happened 3 years ago that's maybe significant to you?
Yeah, I tried to retouch with my mother after my father's funeral. She's still the same.
Still the same. How did it go? What happened?
I went to go talk to her about the problems I was having and, coping with my father's death. I became a lot more sexually active at that time than I already was. And I really just wanted her to, know me, understand me, where I was coming from, but she was very detached as usual. She didn't really seem to care. And then quickly, into our conversation, she said she had to go.
Do you know, is she still drinking?
Probably. I could smell a little vodka on her breath.
And is she still smoking?
Yes. Her coat reeks of cigarette smoke.
Interesting. Well, tell me, let's go back to the dream you had. You said that you were with a professor?
Yes.
Do you know what school he was a professor at?
University of Hartford.
Did you attend University of Hartford?
That's where my dad teaches. Well taught. That's where my dad taught.
Okay. That's interesting. Do you think that you can deal with your emotions outside of turning to men?